The president isn't the only world leader who has contracted the virus. Back in April, British Prime Minister Boris Johnson spent time in the ICU being treated for COVID-19. The president of Brazil had a milder case, as did the leaders of Bolivia, Honduras, Guatemala, and Monaco. ABC 7's Maria Serrano spoke with a local doctor about how any of these officials could get sick, given all the protections of the office.
My reaction is not terribly surprised that even though you do everything you can to test and shield those around you and make sure you're able to exist in a halo, we can't fully guarantee that. The president has very publicly traveled and been at large rallies and had a lot of people around him.
Dr. Rodney Young, professor and chairman of the Department of Family and Community Medicine at Texas Tech University Health Sciences Center in Amarillo, tells me even with efforts at testing and relative isolation, COVID is difficult to control. He says there are vulnerabilities to COVID, including a person's age.
Being 74 years old, there's a little more risk associated with that. Clearly, being the president affords you a lot of resources that aren't available to the entire world, but we don't have anything magical in terms of the treatments associated with a virus like COVID.
Dr. Young adds that the reactions to COVID tend to be unpredictable.
We can have a young, healthy person who has a very severe course of illness, and we can sometimes have frail elderly patients with a number of predisposing risk factors who actually fare just fine.
Time will tell how COVID impacts the president. Dr. Young says with all COVID patients, physicians hope for mild cases.
But it's also entirely possible that he could become potentially even quite ill with an illness like this.
He says COVID can be potentially more lethal in males, those affected by chronic disease and age. For ABC 7 News in Amarillo, I'm Maria Serrano.